linear and continues to cause suffering and death for millions every year. Tuberculosis remains one of the world's top infectious killer, causing 1.6 million deaths each year and affecting millions more, with enormous impact on families and communities. Here's more details of that in this report by Yahya Jammeh.
World Tuberculosis Day this year is being commemorated under the theme Yes, We Can End TB, to promote optimism and foster high-level leadership, increase investments, rapid adoption of new WHO recommendations, and strengthen multi-sectoral partnerships to combat the TB epidemic. The COVID-19 pandemic, coupled with ongoing crises such as armed conflict, food insecurity, climate change, and the political and economic instability, has reversed the years of progress made in the fight against TB. Last year, for the first time in nearly 2 decades, WHO reported an increase in the number of people falling ill with TB and drug-resistant TB, alongside an increase in deaths. WHO has sought to support countries by expanding the treatment and detection of TB.
TB is a preventable, treatable, and curable disease, and yet it still kills 1.6 million people each year and affects millions more, with enormous impacts on families and communities. We cannot end TB unless we address its drivers: poverty, malnutrition, HIV, tobacco and alcohol use, poor living and working conditions, stigma and discrimination, and more.
Meanwhile, Dr. Teresa Kasova, director of WHO's Global Tuberculosis Program, said that the fight against TB should be collective at both national and international levels.
We at WHO are calling to fast-track efforts to ensure all people with TB access quality prevention and care, in line with the WHO drive towards achieving UHC, particularly for the most vulnerable populations. Yesterday, WHO and over 10 key partners, including civil society, launched a call to action urging governments and other stakeholders to accelerate the implementation of novel 6-month all-oral regimen for the treatment of drug-resistant TB.
The World Health Organization's Director General flagship initiative on TB builds on the progress achieved and lessons learned from 2018 to 2022. It aims to scale up the delivery of quality care to people living with TB through equitable access to WHO recommended rapid diagnostics, shorter all-oral treatment for infection and disease, increasing the access to social protection, and other innovations including digital tools for health. In September 2023, the United Nations General Assembly will convene 3 high-level meetings focusing on universal health declaration, pandemic preparedness, and response, and ending TB. There are clear linkages between these agendas, and the heads of state will deliberate to accelerate action, including the goal to end TB. Reporting for Eyeafrica News, I am Yahya Jammeh.